Even the smallest toddlers have little baby dolls for which they love and care. They cuddle it and feed it and push it around in a miniature stroller. So many years later, when that toddler is now an expecting young woman, it sometimes happens that despite all that practice with her baby dolls, our new mom-to-be doesn't know what she's supposed to do now that the real deal is on the way. Well, the first step is to call your doctor.
Once a woman determines that she's pregnant, she should call her doctor's office. The doctor will then determine when she should come into the office, depending on her risk factors for abnormal pregnancies. For instance, if a woman has had multiple miscarriages, you might not want to wait a few weeks to see how the pregnancy is doing. Usually in my practice, about after 6 weeks from your last period, the new sonograms that we have now can actually see a live fetus at about 6 weeks. And determining a fetal heartbeat really puts the woman's mind at ease and also decreases your risk of miscarriage by a great deal.
The first 13 weeks of pregnancy is called the first trimester. And though a woman won't really look pregnant at this time, this is the most crucial time for baby's development. Nearly all the body structures and organs are formed and beginning to function by the end of this trimester. And while all this is going on with the baby, moms typically experience fatigue, achiness, and that infamous nausea, or what we call morning sickness.
Morning sickness is either nausea, vomiting early in the pregnancy. It has to do with elevated hormone levels from pregnancy and the woman's susceptibility to these hormones. The nausea center in the brain is stimulated and the woman feels nauseous many times in the morning, sometimes all day. There's some theory that this might be protective to decrease the activity of that woman early in pregnancy to allow more energy from the woman to be directed towards the pregnancy. It can be very difficult for some women. It can be debilitating, and everyone is different, and it's usually out of their control. There are a whole host of new medications to take early in the pregnancy that have been tested either in the research lab or out in the field where women just had to be able to work and were on these medications. They have not seen any problems with the fetuses.
What is safe to do or consume during pregnancy is often a mom's very first question to her doctor, and it's an important one. Everyone wants a healthy pregnancy, delivery, and baby, and there are certain things that moms can do to give their babies the best odds of excellent outcome.
One is the cessation of smoking. Decreasing in smoking will increase the oxygen level in the blood, and also by not smoking during the pregnancy, the toxins from smoking can increase her chances of having a full-term pregnancy and decreases her chances of high blood pressure or placental bleeding problems. Women should be on prenatal vitamins a few months before they get pregnant in order to have adequate folic acid levels to prevent neural tube defects. They should try to be at a normal weight to decrease maybe diabetic effects of pregnancy, which can be weight-related. They should exercise just to keep themselves toned. Stay away from x-rays during the time that she's trying to get pregnant.
So now that you know all the basics of getting started on your pregnancy, all you have left to figure out now is how to take care of the baby once it's born. I say take a parenting class and maybe pull out that old baby doll so you can practice changing diapers. Trickier than it looks. And ladies, don't drive yourself crazy worrying about all the new sensations you're experiencing. Just ask your doctor. Most of what women worry about is just common pregnancy symptoms. Never hurts to ask. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.